This is Chapter 7, Infection Control, on our clinical procedures. This is something that you're going to see over and over again also in this program. It is the links in a chain of how infectious agents get into our body. And so we'll go through this just rather quickly. You can kind of be looking at it yourself. Infectious agents at the top, it would be bacteria, fungi, viruses, protozoa, and rickettsiae. And of course, at the top of the circle, you have that we use standard precautions, and we can use standard precautions against all of that, all of our infection control that we use. Clinical identification of lesions. That would be something that we would need to look at when we're looking at infectious agents. So what it's saying is that first you have to have an infectious agent, and then you go to the right, you'll go down to reservoir. You have to have a reservoir for the infectious agent to be in. That could be on your person, on people, it could be on equipment, your instruments, water from your tubing if you don't flush your tubing. So once again, if we get what we can do to protect ourselves is to make sure that the dental team is healthy with immunizations and they're all up to date, and also using standard precautions can help stop the chain from going any further. But the next thing you would have to have is a port of exit. So the port of exit might be secretions or saliva, it could be blood, skin and mucous membrane, or droplets. If you're using a Cavitron, for instance, it would produce aerosols in the air, and you could have droplets or spatter coming from the patient's mouth, and sometimes they could be large enough for you to be able to see, and most of the time they are not. They're smaller than they're out there, but you may not be able to see them. Just like the commercial that they used to have on television where they had slow motion of a woman or a man sneezing, and they sneeze and it's like real short sneeze, but you see everything that spreads out in the air even though they're trying to cover their mouth. So these things can be almost microscopic, and we just need to always imagine that they're there, and then take precautions against that, and then that way we can help to control. But the next thing you have to have before you have an issue with an infectious agent is you have to have some way to transmit any of that aerosol or spatter, blood, saliva. You have to have some way to transmit it, and that could be by direct contact. You could be touching it yourself, or indirect contact. It could be airborne. So there are certainly ways that in direct contact, you can have your gloves on, have your hands in a patient's mouth, be touching the saliva, the blood, whatever, and then you take your hands out of the mouth and you're doing whatever, your arm itches, you scratch it, you go underneath, you scratch it, you have a little tiny break in the skin there. And all of a sudden it's in your system, or so you have to have a way to transmit it. Then you have to have a port of entry. So the port of entry means that you need to have a way, like your eyes. That's why we have a protection on the eyes for the aerosol and the splatter not to get into the eyes. Your GI tract, your respiratory tract, broken skin, mucous membrane. So you'd have to be able to have some kind of port of entry, paper cut, cuticle on your nail, some way for it to transmit and transfer in so that it's into your system. So once again, what can help against that are immunizations and using standard procedures on the transmission. If we try to control the aerosols, that not using a Cavitron when you really don't need it to put all those aerosols out there, to use high suction every time you have something that would produce aerosols would help with that. So after the port of entry, then now it's in your system, and so you have to be a susceptible host. So if you're super healthy, a lot of times your body can send out neutrophils and whatnot to be able to take care of that and overcome that infection, so that you don't actually become sick. But if you're immunosuppressed or medically compromised, the elderly, the very young, then you could become a susceptible host to some kind of an infection, and then you would have it. But once again, using standard precautions, we cut down on that immediately, and then you'd have some kind of a secondary infection that maybe you have to treat. And this is the chain of links in a chain of how it happens with COVID. I mean, it's exactly the same. It can be out in the air up to 6 feet. And so a port of entry would be respiratory into your lungs. So this is an old tried and true link of chains that have been around, but you'll be seeing this, and I wouldn't be surprised if you would have some kind of a question about this, possibly on tests or boards. And they may say it in a way of, you've caught something, and what do you need to have in order to really come up with an infection? And you could have all of these things, and the answer be you need to also be you have a susceptible host. So there's that. So treatment rooms include the dental chair and unit, your light, the stool, the floor, the sink and supplies and waste that are all around the chair and the space that you're working. So this is the picture of a treatment room. This would be an optimal one where you have the chair, you'd have a barrier cover over the chair, you have foot controls. Everything needs to be easy to clean, no seams, no extra ways of attracting and harboring bacteria of any kind. You have a light, and that has a barrier. Your chair has a barrier. You have your stool with foot controls, easy to clean surface, no seams. You have a unit. Ours isn't quite like this anymore, but it is it's to just say that they have removable hoses. You don't want them coiled up, all the hoses. You want something that's easy to clean surfaces. You want the pieces that you put on here to be autoclavable or disposable, and autoclavable hand pieces that may go there. So then you have some type of a counter where down here you have a large opening for heavy duty liner for waste. And we have to separate the waste in that, having a sealable liner and a biohazard waste that all blood particles and that would go into. So you don't want to put, if you have a piece of gauze that's saturated with blood, you don't want to just throw that in the wastebasket. That is considered a biohazard, and it goes in a biohazard waste. At our clinic, we have biohazard bags, and they are kind of a reddish color with the biohazard sign on them. We have one hanging up in each op for you to be able to drop things in there. So you don't use the biohazard bag for anything but biohazard materials. So if you're going to throw away Kleenex or anything disposable, your gowns, your mask, your gloves, they all go in the wastebasket unless they're saturated with blood. You're going to have a sink. Hopefully it's stainless steel, and electronic foot controls like we have it, where we can just use our foot to control the water, and we don't have to constantly be touching anything else on there. So you'd like it needs to be deep for washing up to the elbows. Ours is not as deep or wide at our office, at our school, in between the operatories, but we do have deep sinks in the sterilization room. Then you have a sharps disposal. For those who haven't been in the dental industry, sharps disposal is some kind of an area where you can drop anything that's sharp, like a needle. You want to put needles in there. We don't put, anything else that's plastic or that could just be thrown away in there, but they're for sharp materials. Needles, cartridges, used cartridges would go in there. And then we have a company that they pay to come pick up the sharps bottles and take them to a special place. They just do not get thrown into regular trash. We have supplies to where we have gloves and sterilized or disposable utility gloves. Our utility gloves are sterilizable. Our exam gloves are disposable, and we also have napkins, paper napkins for drying off, and of course is disposable. And we have barriers, which is disposable. So instrument or processing center, you can call it that. You can call it a sterilization room. That's the place where you do instrument cleaning, instrument packaging, and when you're in there, you wear full PPE in the sterilization room, including your goggles. So there's always, if you look in the clinic up on high above the entrance and exit, you will see enter and exit signs. And that's because sterilizing rooms are meant to go in one direction. You go in, you walk in with an enter into the non-sterilized section of it, and then you clean your instruments there. You would clean all of your instruments, and they're all contaminated. You need to disinfect them and rinse and dry them, and then we package them in the middle, and then we seal them and put them in an autoclave for sterilization. Then there's a counter where we put them on the counter so that they can dry. We stack them all up. So it's a one-way. Ours just goes the opposite way, but you need to have like an entrance and an out. So instrument cleaning, you can have like a dishwasher. We used to have that, where that big, huge trash can now sits underneath on the dirty side, which if you're facing the sterilization room would be on your left. It's ultrasonic processing center is there also. The washer or thermal disinfector needs to have a high hot water velocity and detergent. The problem with those, we had one, it was really awesome, fit all of our cassettes in them, etc., dried them at really hot areas. So we did not use the ultrasonic cleaner or processor at all, but it kept breaking. It breaks. It's used in the school so much, and it broke, and it was expensive to fix. They kept fixing it over the years, and finally about maybe 3 years ago, they decided just to take it out, and we go back to the old way, but tried and true way of putting our instrument cassettes into an ultrasonic processor and cleaning them that way. So when they come out of there, they are put directly into the sink and rinsed off, and then put up there on the side so it can dry before we package it for the ultrasonic. Ultrasonic processor is definitely safer than manually cleaning. The ultrasonic processor is just a cleaner. It's a cleanser to just kind of shake through the vibrations, any debris or particles off of your instruments. And it's not a substitute for sterilization. It doesn't mean it's sterilized. It's just hopefully cleaned off. If it's not cleaned off when you take and inspect that case and you still see that there's a little bit of blood on an instrument tip, then you would need to put it deep into a sink, put on some utility gloves, take a wire brush, a long-handled wire brush, and brush over the instruments while they're still in your cassette. And so what we're trying to avoid is being accidentally stuck. Those instruments are sharp, and they can, on the sides of them, and they can go right through a glove and into your skin, which is not something you would want. So most of the time, everything can come off by just use of the ultrasonic, though, so that's a good thing. And I already talked about the manual cleaning. Instrument packaging, the purpose is to, of course, prevent contamination. We arrange the instruments into a cassette. We put them in trays or packages. We mark whichever is chosen. So we always put a date on the back, stamp a date on, that we know when it was sterilized, and you put your name and number on them also. So preparation, following manufacturer's recommendations. Each ultrasonic may run a little differently. You have to read whatever your machine is. You've got to read the instructions for that and follow those. So you want them in a sturdy wrapper. You put a chemical indicator tape around it on the sides, and it is absolutely required. We put a chemical indicator strip on the inside of the cassettes, just as an extra precaution. And we don't unwrap them when they come out of the ultrasonic. We don't unwrap them until we're directly in front of a patient. And so they know that they're getting fresh, sterilized instruments. So this is what a paper wrapping would be. It has like some cellophane looking clear. You can see through it on one side and paper on the other side. You have this tape, and A shows the tape being put on there. B shows that those little strips become really black, and that shows that a certain temperature definitely was reached to decontaminate the instruments. So the approved methods are moist heat, steam under pressure, dry heat, chemical vapor. So you have that packet to fill out. You can get a lot of information from this particular chapter. And if you're not finding something, look through this PowerPoint. So methods of selection, you have to provide complete destruction of all microorganisms, viruses, and spores without destroying your instruments or anything else that's in there. So that's what we're after. They have tests for the sterilization. We have an external chemical indicator. This is used to seal the package, and it changes the color to show the temp has been reached, like the striped tape, like I showed you. We have an internal chemical indicator. This is the little strip that we place inside the kit to show steam and temperature for a required amount of time. So it's not just about putting them at a particular temp, it's putting them at a particular temperature that is reached, and it's keeping in there X amount of time to make sure that all the spores and viruses and microorganisms are destroyed. So then once a week, once a month, the CRIS will come in and do a biologic monitor, which tests the autoclave. So we won't have anything maybe in there. Maybe that it will be in there with a set of instruments, and she'll put a biological monitor. This gets sent in to a company, and they come back and tell us that our autoclave is always running the way that it should be running and reaching the temperatures for the length of time that it is. So we have a lot of ways that we try to keep on top of the sterilization. Now, moist under heat is what ours is at the clinic, and this is what most of the offices I ever worked in had steam under pressure, and so it's called, which is moist heat. It's called an autoclave, and it works by the action of heat and moisture. So we pack the autoclave very loosely to permit steam to reach all of the instruments. We don't, which a lot of offices do, keep piling things on top of each other. We want a level playing field there so that we can make sure that the steam can get into the individual packages. The temperature must remain at 250 degrees for a 15 to 30 minutes. Ours is 30 minutes. We don't put oils or waxes or powders in there at all, anything. And those mainly come from items that the dentist would use, not that we would use. Care of the autoclave, we have to maintain proper amount of distilled water, wash the trays. It has a weekly flush chamber discharge system with a cleaning fluid, and they test for those spores once a week. So I guess it's not once a month, it'd be once a week. And Chris does that and keeps a log of them, and then we get them returned to us telling us what our report was, and ours has always been good. We have to check the seals around the autoclave door to make sure that the seals, it gets such a high heat in there that every now and then we need to replace one of the seals. You can usually tell if it's working or not if the autoclave is kind of dripping. Maybe one of the seals has lost its workability and we need to change the seal. So the advantages of steam under pressure is that all forms of life are destroyed quickly and efficiently. A wide variety of materials may be treated in there without being ruined, and it is actually absolutely the most economical, which is why most offices have them, or because of those reasons. Sterilization is achieved by the action of the heat. The heat is what is going to sterilize them. The pressure serves only to attain that high temperature. So the pressure comes, it gets up and up and up until it gets to a certain temperature, and then it has to be in there for 15 to 30 minutes, ours is 30, and maintain that temperature, and that's what the pressure's for. Then there's dry heat. Dry heat, the action here is oxidation for materials that can't be sterilized with steam under pressure. For instance, a lot of things that the dentist uses, very small metal instruments like burrs and things, powders, oils, things like that may have powders or oils on them. They need dry heat, not a moisturizing heat. This particular way of sterilizing has 320 degrees for 2 hours. It is the longest. So for 2 hours, it takes for those instruments to become sterile. It is the longest. Sterilization starts when the entire contents have reached peak temperatures. So with the steam under pressure, it is starting to sterilize while it's reaching up to that height of 250 degrees. But for dry heat, it doesn't even start until the entire contents have reached peak temperatures, and which is why it takes so long. The good thing about this is there's no corrosion as compared to steam on our metal instruments. They can be a little corroded after a while. On the tips, which is not great, but there's all you need to do to remove that, if that happens, is take a rubbing alcohol 2x2 and remove the rest. And then your instrument is good. So the length of time makes this very impractical for most general practitioners. Then you have the third kind is a chemical vapor sterilizer. This kind is going to combine all sorts of chemicals that don't smell great at all. Alcohol, formaldehyde, ketone, acetone, water. It's all heated under pressure and it produces a gas. So this is a chemical vapor, gas vapor. that is used as the sterilizing agent. So microbial and viral destruction results. It's heavy, tightly wrapped packages would not really be able to permit the penetration of vapors. So would not be good for our tightly wrapped cassettes. It needs to go up to at least 270 degrees for a minimum of 20 minutes. Disadvantage is that you need to have adequate ventilation because there is a slight odor and it's not a good one. It cannot be used in a small room because of the odor. The advantage is that there's no corrosion and it's completely rust-free for carbon steel instruments, and it only takes 20 minutes. But no one can really use this because you'd have to have a larger facility than most dental offices to even be able to, with such a great ventilation system, that it makes it undesirable for offices to have, so they usually opt for the steam under pressure. So care of your sterile instruments. You want to store them. When we store them, instruments without sealed wrappers are only sterile momentarily due to airborne contamination. This is another reason that we don't open any of these packages until we're right in front of the patient, because as soon as they are out there in the air, if the person next to you is using an aerosol, you can see how that would not be great. So labeled, we always label them with your name. The sterilized and sealed packages are stored unopened in a clean, dry cabinets or drawers, or in like our storage room where it doesn't get a lot of heat from the sun, etc., and it's away from everything else. The shelf life, if you have wrapped sealed packages in paper, is several months to a year. So we do 6 months just to be on the safe side in our offices, and we've never done under a year. So let's say most offices and our clinic has sections to where we have extras, extra mirrors, extra syringes, extra all of this. So we keep those, and that's why we have a date on them. We always stamp a date on there because every so often we go through and we will need to unwrap them and repackage them and re-sterilize them with a new stamp if they are close to the 6 month or at the 6 month period. So, which is why there's a date on them. So plastic or nylon wrap with tape or heat seal is sterile for a while longer. So I will let you go through this question and answers and move on. We have chemical disinfectants then. Okay, so these disinfectants, what we were talking about before, have to do with our instruments and sterilizing instruments and utility gloves, which can be sterilized, etc. But now we're going to talk about chemical disinfectants, so that things that we can spray on the chair, on the countertop, on different things, and what we need for those. They're used in several forms for surface disinfectants, immersion disinfectants, immersion sterilants, and hand antimicrobials. So disinfectants come in 3 levels. You have a high level or a hospital level, an intermediate level, and a low level. And these are all categorized by their ability for their biocidal activity. Biocidal is the death of microorganisms and bacteria. So they all have a different level of what they can destroy and what they cannot destroy as far as bacteria. So the biocidal activity refers to the ability of the chemical disinfectant to destroy or at least inactivate living organisms. So we'll go through those now. You have at the high level, you're going to inactivate, which means to destroy, spores. And this is the key thing that that they go by, because the ones below do not destroy spores. They'll destroy a lot of other things, but not spores. So we've like a high level that will destroy spores and all forms of bacteria, fungi, and viruses. A high level is either a disinfectant or a sterilant. You don't have to know much more about that. We'll move on to the intermediate level. These disinfectants inactivate all forms of microorganisms, but they do not destroy spores. The low level are disinfectants inactivate vegetative bacteria and certain lipid type or protein type viruses, but they don't destroy spores, TB, tubercle bacilli, or non-lipid viruses, which is non-protein. So here's some questions on the review about which statements are correct and incorrect. I will let you go through. You will, I'm sure that there'll be at least one question on boards about, they could ask about any of those. You need to know which disinfectants are, what high, intermediate, and low level disinfectants can destroy and what they can't. Then we need to have an EPA Environmental Protection Agency, which is what that stands for, an EPA approval. We have to use an EPA registered hospital disinfectant with a tubercidal claim for immediate and intermediate and high levels, especially when there's visible blood or potential infectious material, which includes dental hygienists, because we are going to have visible blood and infectious material. So the big thing is if they can kill the tuberculosis bacilli. So it must be tubercidal for tuberculosis, virucidal for viruses, and fungicidal to kill the funguses. The label must state on the product that you buy, it needs to state its shelf life, use life, reuse life, and type of container for storage and placement, whether it can be by heat or some kind of lighting. Instructions for how do you dispose of it. You don't just throw it down the drain or throw it in the trash. Any warnings and the directions for use. So an ideal disinfectant. You probably have a question about this on the midterm or final. Here are all the things that would be ideal if they came to you and said, we want you to choose, do some research and of all the different disinfectants that we could use and choose one for the office to buy. You'd want to look at something that had a broad spectrum. It would kill lots of different things. It could be on lots of different things. It needs to be fast acting. This is a fast profession. It's active in the presence of organic matter such as blood, sputum, and feces. It needs to be non-toxic, of course. It needs to be surface compatible, which means that it's not going to ruin your chairs when you spray this on them, or your countertops. It has to have a residual effect on treated surfaces so that you can see it. It needs to be easy to use or people won't use it. It needs to be odorless and economical. So you want to try to get as many of those things as you possibly can get. Preparation of the treatment room. Objectives would be to handle the instruments and equipment in a way as to control any kind of transmission of disease, of course. So you're going to be always planning for this. And hand contact, you want to only those essential to your service to your patient. So in other words, you are going to adjust your hair and adjust your glasses, get everything on your counter in, if you're going to be using those in an order where you can just reach over and grab something, but that you don't have to get up and down into cabinets, trying to collect things that you would use. So that's one way to not transmit. You need sterilizable items, unwrap them in front of the patient. Disposable items, use whenever it's possible. Obviously, disposable would be the best. Items that may be covered, you're going to use barriers on handles and different places that you will have seen on this first week that we're coming to of class. Items that require chemical disinfection, you want to use that. So cleaning and disinfecting environmental surfaces, the agent, iodophores, complex phenols, glutaraldehydes, they're extremely caustic. And so you want to have on utility gloves, heavy duty utility gloves, and a mask when you are cleaning your chairs and the countertops around the sink, the doors to the cabinets, etc. So the water unit lines, biofilm of microorganisms can form on the inside of the water line tubings even just overnight. So that's why we flush the lines for 2 minutes at the beginning of each day to remove the chemicals. We're going to flush the lines for 30 seconds before and after each patient. And we flush 30 seconds due to the backflow clip. We have a backflow at our clinic, which prevents when the patient, when you put the suction in the patient's mouth and say close down and they kind of suck on it to remove any liquid and saliva in their mouth. If you don't have a backflow clip, you can have kind of a backup of all of that can happen and have a backflow of it, those microorganisms and everything inside of the tubing. So the backflow clips are very inexpensive. If you don't have one, you are not supposed to have your patient use a suction method with their mouth on that suction tip. But we do happen to have them, and since we do have them, we only need to flush our lines for 30 seconds due to the backflow clip. If you don't have one of those, you need to flush it for 2 minutes. 2 minutes at the beginning and end of each day, and 30 seconds in between. Since we have one, we can do our lines, flush them for 30 seconds at the beginning and end of each day and 30 seconds in between. Okay, I'm not sure which boards will do. Hopefully they won't ask this type of question. I know you'll have some, you may have some review books when you're studying for boards that will talk about this, because boards, you could get a different answer depending on if you have a backflow clip. But you need to know the difference of what we do and what you do when you don't have one of those. How long? So patient preparation, we always did a pre-procedural oral hygiene. We did a pre-procedural rinse. Okay, because it helps to reduce and minimize the oral bacteria, like toothbrushing. Rinsing with chlorhexidine provides reduction for at least 60 minutes. It was always said to be. Now they've come out with something just during this last 6 months to a year where they've done so many studies for X amount of years that they have come out and said that their studies show that it doesn't really reduce it for very long at all. So they have kind of gone away with the pre-procedural rinse. However, some people, it really helps for the smell. You can kind of smell infection and periodontitis on some people if they have perio issues when it's really, really severe. And you may just want them to do that for your comfort. So we used to have to do this, and now it's kind of, you can do it if you choose to. So an application of a surface antiseptic prior to injection. When you're going to give an injection, sometimes you get a cotton tip applicator and put it in something with an alcohol base like Listerine or something and go over that tissue that on the mucosa. And then we'll put the topical on because it just helps clean any of the extra floral off. Anytime you put a needle and pierce it into the tissue, whatever is on the surface of where you're penetrating the needle is getting pushed into your system. So it's just another way to make sure that everything is as clean as possible. So you can, this pre-procedural rinsing and preventing spread of communicable diseases are of the older thought, and they may still have this on boards though, so I want you to kind of know both ways. So patient factors, you need a comprehensive patient history always, and assess that history, medical consultation or referral for patients suspected of carrying infectious diseases. The pre-procedural mouth rinse was always a big one, and now that is up to you if you want to do that. They don't, studies, like I said, don't really show that effectiveness, but they absolutely have to do a protective eyewear. Clinic preparation, waterline cleaning includes air, water, syringe, your hand pieces, and the ultrasonic all need to be drained for 2 minutes at the start of each day, 30 seconds before and after patients. And once again, on our, this is exactly what I was talking about before with the water line. What it's including here are for hand pieces, and the ultrasonic is for the same, this has the same issues as far as running those lines. Environmental surface disinfection, all surfaces that may be touched during the appointment need to be cleaned off. And instrument sterilization, once again, open in front of the patient. Can't stress this enough. So many things that I want to really soak into your brain. I'll put multiple times through a PowerPoint because you're getting a lot of information. Factors for the dental team, your care team medical status. The immunizations need to be kept to date. We need to use the PPE, have meticulous hand hygiene before and after donning gloves. An aseptic technique, minimize contacts with other parts of the cubicle if you don't need to. And once again, all of these come from OSHA or the CDC. So now they are even upgraded to the fact of how we sterilize a chair. We need to wash it down with soap and water first, and then leave it wet with disinfectant. Treatment factors, removable oral prosthesis. You need to wear exam gloves before placing, if someone takes out a partial or a denture, places it in a cup or a baggie, and cover it with disinfectant, which you will be shown in the sterilization part. You need to clean it in the ultrasonic. You wear goggles and a mask always while you're doing that, so that if the ultrasonic splashes, it does not get in your eyes and mouth. You always rinse the prosthesis before returning it to the patient. Post-treatment cleanup, you want to always use heavy puncture-resistant gloves to handle the instruments, and follow routines to disinfect and clean. Contaminated waste is secured in plastic disposable bags, and the disinfectant safety eyewear for the patient and clinician. You really won't have much of a problem, I don't think, with most of our patients during this COVID time, but there's a handfuls of people here and there who don't believe that the masks do everything. But if they want to have a cleaning at our clinic, then these are the protocols that they need to adhere to. So accidental exposure, significant exposures, maybe blood, saliva, or body fluids. Anytime that happens, it requires prompt action. So if you're patient or you actually stick yourself or accidentally stick the patient with a contaminated, needle or instrument, then this is what we're talking about. We need to follow a certain protocol for accidental exposure. We have first aid procedures that we do first. We're going to wash the wound with soap and water, and you always report it to an instructor right away. You're going to always need to document the complete incident in your notes. You always are going to follow up, report any signs or symptoms from yourself or the patient, and this is all taken from the cdc.gov. So there's regulations of each city's sanitation division regarding their disposal of contaminated waste and how it should be done. So we have a way that disposable materials such as gloves, masks, wipes, surface covers, contaminated with bodily fluids can be discarded in impervious plastic bags. The sharps or needles can be discarded in red plastic containers, of which you have a sharps container. There's a hole next to the trash where the sink area in between your operatories. This is the universal label for hazardous material. You may be given this sign and ask what this is for. So it's for hazardous material.